Good morning again, everyone. Craig Wallin here in our wellness segment, and we're at the offices of Dr. Norman Bryan and Dr. Anjana Gupta. The dental office is here and focusing a lot on dental medicine. We're going to talk more about that with Dr. Bryan in just a second. But Dr. Gupta, last time we met, we talked about CEREC, and that was an interesting topic, and I want to remind folks that they can review what we talked about even online at myfresh.tv. But there's some really neat things happening in that whole arena, aren't there?
There sure is, Craig. It's one of the newest, I think, most fascinating updates in technology in the field of dentistry is the CEREC machine and this 3D imaging. It eliminates the impressions, which a lot of people don't like, and it really is a huge time saver for people that work and have to take time out of their day to come to the dental office. It cuts it down from 2 appointments to 1 appointment, which I think is a really important factor.
Absolutely. Well, Doctor, thank you very much. And again, if you'd like to go and see what we're talking about, myfresh.tv, and the link to Dr. Bryan and Dr. Gupta, of course, up there as well. So that's where you can go right into their website and find out everything that we've been talking about here during these segments. Well, Dr. Bryan, another interesting topic lying straight ahead this morning.
Well, yes, Craig. I'd like to kind of touch on the TMJ and what we do here for that. Of course, we had talked about sleep apnea and TMJ before. One of our areas of expertise here is TMJ, and TMJ refers to temporomandibular joint, which we all have, and specifically to any disability in that joint, any problems with that joint. There are several types. We belong to the American Academy of Craniofacial Pain, which is an academy of about 600 dentists in the United States. And that academy addresses basically headache, back, neck, shoulder pain, that sort of thing, and specifically TMJ issues. It takes some expertise to become a fellow of that academy. I'm fellowship eligible, which means that I have treated over 250 patients, and we've taken over 400 credit hours, postgraduate credit hours to attain that level. So this is an area we feel very strongly about, and an area that we feel we can really help a lot of people with.
And a big difference, too, Doctor, between the expertise and the specialty, and we're going to talk about that in a little bit. But right now, we're going to go back into one of the rooms, the exam rooms, and kind of learn a little bit more, right?
You bet. Come on back, and I'll show you.
All righty. All right, we are here. Thank you, Dr. Bryan.
Sure.
And we did discuss in past shows a little bit about TMJ, and I know you are well experienced in treating folks that have a problem with that joint. We're going to talk a little bit more specifically about how to go about all that today, though, aren't we?
That's right. That's our main emphasis today is to talk about the TMJ, the temporomandibular joint. As I said, that's one of our main focuses here. I've been working with the TMJ focus for over 30 years, a member of the American Academy of Craniofacial Pain, as I said. And I want to just address a little bit so people understand what this is all about.
Yeah, and Doctor, when people come here for the very first time, you kind of put them through a little bit of an evaluation, don't you?
Exactly. We have several questions that we always ask patients pertaining to their TMJ and their jaw joint. And those questions specifically are, do you have frequent headaches, neck and shoulder pain? Does your jaw get tired easily? When you chew something, does it tire? Do you notice that you definitely have to take a little break once in a while? Do you have a limited opening? Does your jaw click? Does it make noise when you yawn or when you shift from side to side? Do you have a bad bite? Do you notice that your bite doesn't feel comfortable? Obviously, have you had an injury? That's also very important. Do you wear dentures? Do you have missing teeth? Do you have teeth that are possibly worn down, or do you brush or grind your teeth? All of this is very important to the jaw joint itself. Obviously, when we talk about TMJ, we're also talking about sleep problems. Many times these people are also sleep apneic or they snore. So these are all questions that we ask our new patients.
All interrelated, and I would think that these are areas that you have to know what you're doing. You just can't kind of pretend that you can treat these folks. You have to have a little experience, and you've had a lot of experience. In fact, certification's very important, and all of the other things that go along with that.
Well, I believe the academy, like I said before, it's very important that we keep up with these things with our CE credits, our continuing education credits. Any general dentist can treat TMJ, and many of them do. But I think that the experience and taking the courses is very important, and so we pride ourselves on doing the best we can for these people and being as educated as we can be.
You have a number of different paths that you can take when treating a person, and you mentioned to me earlier there are actually 4 different ways of treating people that have those kinds of disorders, surgery being the last. You don't see that much. In fact, you said you haven't seen a surgical procedure like this in, 20 years?
Well, we try to be as conservative in our treatment as possible. Obviously, when we see a patient that has a problem, we want to try to see if, first of all, it's something that they can maybe help themselves with. A softer diet, for example, maybe some massage, hot and cold therapy, taking some medications like Motrin or Advil, which will kind of help the inflammatory response. So first of all, can they do something themselves that might help it? Secondly, there's some physical therapy things they can do, some exercises, some massage, things like that that also are very helpful. One of our main areas that we look at is we use appliances. We use types of retainers that may change the bite or change the position of the jaw that significantly improve it. So many times when we have injuries, when we have bad bites, we correct that jaw position, which is very important. Lastly, like I said, is a surgical procedure. We try to avoid those, and fortunately for many years we have avoided those. Now there are those cases where there's no choices, but fortunately we've been able to manage these cases very conservatively and feel that we've done an excellent job in doing that.
Dr. Bryan, I know every situation is different, but can you say in general, when a person comes in here, gets the evaluation, they can expect maybe over a period of months, a year or two, that they would experience some significant relief?
Actually, that relief usually comes much quicker than that.
Really?
We look to have the patient very comfortable within a 90-day period. If we haven't, then we want to look in another direction and see if maybe there's some other things going on here. But usually we give ourselves a 90-day period where we feel that we can treat this patient and make some significant changes in their life.
That is very interesting. Well, folks, a lot of detail here and not a lot of time to talk about it, but just trust me when I tell you that these are the folks here that are the experts, and Dr. Bryan, Dr. Gupta and their office here can treat you and can evaluate your situation. And Dr. Bryan, there is a website. We want to focus on getting people more information when they have a moment. They can go to myfresh.tv, but when they go there, they'll find the link to Dr. Bryan. And in that website, Doctor, what kinds of things can they find on TMJ specifically?
Well, we've tried to do our best with the website to answer as many questions as we can. It's very specific. It goes to several facets of the not only TMJ, of sleep apnea, of many of the things that we do here in the office that we feel very happy about and feel like we can really make a difference to people.
All right. Again, go to myfresh.tv, go to the Dr. Bryan link, and you'll find out a whole lot more about the dental medicine practice of Dr. Norman Bryan and Dr. Anjana Gupta. Doctor, thank you again. Great speaking with you and always informative.
Thanks, Craig. Thanks for coming in.
We'll be right back. Stay tuned.
Coming up next, Julie talks about events at the Elkhart County Historical Museum.